by Dr. Kaisuke Mori, histopathology of rotator cuff tendons in elderly patients with gleneal arthritis without cuff tears.
It's good to be here. My name is Daisu Mariko of Japan. So we have not conflict of interest. In operatively treating elderly patients with gleneal arthritis GHOA with an intact cuff, rotator cuff tears following TSA is a big issue at reported different rates. RSA is an increased popular option for such patients because of advanced technology. However, which option is better remains controversy among orthopedic surgeons. So, to solve such controversy, we conducted the two comparisons. First, we histologically analyzed the torn edge of the cuff tendon by harvesting cuff tissue from patients with GHOA or cuff tear arthropathy CTA patient or patient with a proximal humeral fracture at the time of the reverse shoulder arthroplasty. Second, we compared clinical and radiographic outcomes for patients who underwent TSA or RSA when the patient reaches over 80 years of age in TSA or RS group. We harvest the tendon samples, 15 samples in 3 shoulders in 2 patients with OA and 24 samples in 20 patients with CTA and 3 samples in 3 patients with a proximal humeral fracture for control shoulder. And we compared clinical and radiographic assessment for 7 shoulders in 6 patients for TSA as a TSA group and 19 shoulders in 50 patients for RSA as an RSA group. We identified the secondary dysfunction by presence of either moderate or severe superior subluxation on the radiographic assessment according to the Young et al. Criteria. We use a histological analysis using a Bonner score. We measure the field diameter and observe histological section using a transmission electron microscopic analysis. There are no significant differences in the Bonner score between the CTA and OA patients. Historical findings and appearance were similar in the patient with the OA and the CTA groups. There are no significant difference in the field diameter in the CTA and OA patients. Regarding Bonner score in control patients, the scores range from 0 to 6 as a mean 2.7 points. However, case 3 had Walsh-et gradient deformity as a 6 of the Bonner score. So case 1 and case 2 showed the well-oriented collagen fibers with tightly protected, well-demarcated bundle. Regarding a comparison of clinical outcomes, so RSA group was superior to RS group in terms of constant score, constant RS score, and the fracture. For shoulders, 57 one-point shoulder had developed cuff dysfunction as a moderate subluxation. Important findings in this study was shown. Severe tendon degeneration in TSA and RS group, and 57.1% of secondary cuff dysfunction in TSA group, possibly because of a fragile cuff tendon based on the result of fiber diameter. RS group was superior to TSA group in terms of constant score and ROM. RSA and RS groups of Bonner score was higher than the scores of the control patient, and case 3 had a granularity. So Young et al. Showed the 55% of the cuff dysfunction and 15% aperture. Based on the result and our result, in conclusion, as elderly patients with OA with the cuff tears had potentially severe histological degeneration of the rotator cuff tendon, which may be possible risk factor for secondary rotator cuff dysfunction and poor clinical outcomes after TSA. Thank you for attention.